We'll start with the penis. All right, look for the monkey face and you can identify the reptile bodies. Cool. Okay, let me put it the other way. So the corpus cavernosum are on top. So I'll point out the things you should be able to identify in tomorrow's quiz. Corpus cavernosum, you should see two of them. Right here and right here. This tissue surrounding the lumen of the spongy urethra is corpus spongiosum. So corpus spongiosum. The epithelium is a transitional epithelium. If I point to the lumen, the space, put spongy urethra. Corpus spongiosum, transitional epithelium, corpus spongiosum, corpus cavernosum. That's the penis. I'm going to look at the transitional epithelium up close. And then I'll move on. Okay, let me get a study guide to make sure I don't skip stuff. So this is 40x. Let's go to 100. Let's go all the way to 400. Pretty good. So if I have you identify that epithelium, just put transitional epithelium. Okay? That's what it is. I could have you identify, if not the epithelium, those dark nuclei, this is corpus spongiosum, right? Because it surrounds it. Transitional epithelium, all of this. Corpus spongiosum, and that's the lumen of the spongy urethra. Yes, very good. Moving on to epididymis. That's a lomag of epididymis, a bunch of cut tubes. Really, it's pretty much one tube, about 20 feet long. And let's go to a 100x magnification. good. Take a picture of that. The question for this simply would be identify. And you just say Epithelium. The trick is spelling it right. Practice it. I may have you identify. I may have you identify sperm. All that is sperm. Okay, this is kind of a storage site for sperm. There's no smooth muscle around the individual tubes there. Let's go to our higher mag to see the epithelium. So the epididymis is lined with a pseudostratified columnar ET with stereocilia. So don't forget about the stereocilia. Okay. So they have a different structure than cilia, so there is a difference there. This does appear to be pseudostratified. Okay, so that is the epididymis, and I'll move on to the spermatochore, which has the vas deferens. Okay, for presentation, this may not be dark enough. Well, it might be okay. Yeah, I think that just dark enough you can see things. And I chose this one because most of them look like this. And we did kind of talk about it in the lecture. And the slide will say vas deferens, but it's really a section of the spermatochore. You can see all the structures that we talked about in the spermatochore. I always look for the little splotch of sperm in the lumen there. That tells me this structure is the epididymis. And I always look for the epithelium. I can even see the darkly staining nuclei of the columnar epithelium at a low mag. So I know that is vas deferens or ductus deferens. Then my eye is drawn to the big blood vessel, testicular artery. That's the lumen. Notice the thickness of the smooth muscle. But look at all the veins. The vessel wall is thinner, and all of these veins happen to be smaller. If I point to any other vein, any other vessel outside of that, testicular artery, you can either call it testicular veins or pampiniform plexus. The other thing is that this is surrounded by an internal spermatic fascia. And that's all I would have you identify from this photograph. Okay, let's go to a higher mag. Picture that. We'll go to, this is 100. We'll go to 400. What I would like to do is get that in 400. That's the vas deferens. So if I go to 400, that's pretty good. So this is high mag of vas deferens. I may have you identify, I always go to high mag so you can identify tissues. That's the whole point of histology. That's what smooth muscle looks like, all of this. That's the epithelium. Most books will describe that as a pseudostratified columnar with stereocilia, although it looks kind of wimpy to me. Let's stick with that. That's what it says in your study guide, right?
Yeah.
Pseudostratified epithelium with stereocilia. So use the full name. Say pseudostratified columnar epithelium with stereocilia. Those are spermatocytes. You can just say sperm. I will accept that.
Oh no, it says ciliated, not stereo.
Oh, you know what? Let's change it. I think last year I kind of like waffled and I did some research to change it. If you mistakenly put cilia, because I made a mistake, I'll let it go. But generally speaking, the reproductive tract for male is stereocilia. And let's move on. Unless there's any questions on vas deferens. I'm switching genders. I'm going to the female biological sex. And let's go to the oviduct or uterine tube. About as good as I can get it. I think we can see enough here. And pretty much, I'll just ask you identify that whole thing is the cross section of the oviduct. That's all you got to put. Oviduct or uterine tube.
Or fallopian?
Yes. I'm going to go higher up to see the epithelium better. Go to a different spot. Okay, I wanted to take a picture of the epithelium. You could see that, well, in lecture, I don't remember I said, most books call it a simple columnar, but all of our slides seem to show it as a pseudostratified columnar epithelium with cilia. So what did you see on your study guide there? It's ciliated. Is it simple or pseudostratified? Okay, yeah, I think I changed that yesterday because I knew I was going to see that. So stick with what you see on your quiz tomorrow if I have you identify that. Go with the pseudostratified columnar epithelial tissue. So I'm going to move away, and it is ciliated, yes. I'm going to move away from that and go to the uterus. Now the uterus is, well, it depends what cycle. Now, this one's going to be the first, roughly the first 2 weeks, the follicular phase. The ovaries in the follicular phase, and the uterus is in the proliferative phase. Go with 40x. All right. Which layer is it? What do you think? Endometrium. We are in the proliferative phase. Very good. But do you see how the tissue changes right around starting there? So below this, what would you call this layer? Myometrium. That's it. Endometrium, myometrium, a couple other things. What if I have to identify this structure? Or this one? Glycogen glands or uterine glands is fine. And I may say identify the phase of the uterine cycle. It's the proliferative phase. Okay, so let's go to secretory phase, see what that looks like. So I'm going to give you the top view endometrium. I'm going to slide it down. You can see the myometrium down there. So the endometrium is so thick I can't get the whole thing in view. But what I'll do is I'll just kind of go to, that's pretty good. Now take a picture of that. So I wanted to get some of the myometrium in view. And so some of these smooth muscle fibers down there are part of the myometrium, so you can see that. And you can see the many, many uterine glands or glycogen glands. And so I feel like that's a dead giveaway for secretory phase. You could call it progravid phase. That's what the slide says. Typically books will call it now the secretory phase of the uterine cycle. Again, endometrium, myometrium. I want to move on to ovary. We did cat ovary, but I got some human ovary this time. Okay. Now it says corpus luteum. So what you got to do is look for the slide that says corpus luteum. I think that's easy enough to do. We don't have too many slides of it. The corpus luteum will secrete progesterone and bring you into the secretory phase. It doesn't show very well. Let's see if I can go 20x. It's a little better. So the second couple of weeks of the ovarian cycle, and it gets you ready for pregnancy. I'll take a picture of that.
After the corpus luteum secretes progesterone, that takes you to the secretory phase?
The corpus luteum causes the secretory phase. Yes.
From the progesterone.
That is correct.
Okay.
This structure right here, do you see that? In there, is the corpus luteum. It secretes progesterone and it causes the secretory phase the second couple of weeks of the cycle. Okay, so both are occurring at the same time. This is formed. It's an endocrine structure, secretes progesterone, causes secretory phase. Progesterone targets the endometrium of the uterus. And so identify that as corpus luteum. That's it. Identify corpus luteum. Done. And move on. Corpus albicans. Let's say you're not pregnant. And well, okay, the corpus luteum has about a 2-week lifespan of secreting progesterone. It shrivels and dies and creates a scar called the corpus albicans. So every time you ovulate and you don't get pregnant, it leaves a scar. So a sexually mature female, after many ovulations, the ovary appears pustulated and scarred. A prepubescent girl, the books will say it looks smooth and pink. Let's see here. All right, well, let's see, let's get into focus. All right, let me see if I can find it here. I'm going to go with another slide, Alan. like this one. We have a bunch of slides that just say human ovary, and those tend to have the corpus albicans a little bit better. So we're looking for a white scar, white fibrotic tissue. Those are some blood vessels. Right there. See the widest stretcher I try to put in the middle? That is corpus albicans. I'm going to try to go 100 mag on it. So this is a 40x. The corpus luteum was much bigger. I had to go all the way down to a 20x to get it in view. So basically this whole thing is corpus albicans. This is what, if you're not pregnant, the corpus luteum dies and you get this, okay? The corpus luteum of a normal cycle when you're not pregnant has a lifespan of 2 weeks. The corpus luteum of pregnancy will last a few months until the placenta can kick in. Then the placenta hormones will.
So the
Right,
corpus luteum
Yeah.
dies if you're not pregnant. and
That's
turns
right,
into
after 2 weeks.
And then it turns into the corpus albicans?
That is correct.
Okay.
Yeah, that's what you saw there.
Did you say after 2 weeks?
After 2 weeks, if you're not pregnant, the corpus luteum will die, yes. If you are pregnant, corpus luteum lasts for a few months until placenta forms. Then the placental hormones will take off and sustain things. Okay. So I'm going to save all those. And what I wanted to show you before we have some lab time today is one of the study guides I posted on Canvas. And I want to give a brief introduction on how to study models. Well, what I did was took some time, and not all the models are up here, but I put a list of structures. For example, this is female repro, so I don't know why I got cut off. But what I would do studying is, this is on Canvas, and if you don't even have this, you can just use your notes, but just make a list somehow. And I put all the models out, females over there, and males over there. And there's many students, so if you grab a model, understand that you should be studying with a few people, so there's enough models to go around. And also, I'll try to upload now the histology figures, so you can start studying that for tomorrow's quiz. And if you look through the slides, there's like labels on, labels off. And if I did this myself, and catch any mistakes, let me know. And I noticed that if students use a PC, it seems to work okay. Each picture will be labels on. Let me just put in presentation mode. Labels on, labels off, and then blank. Labels on, labels off, blank for each one. Labels on, labels off, and blank.
Where is this at?
It's on Canvas. It's been there the whole time. It says Lab Practical Study 1. There's a lot of things up there I know. But look for it. It could be helpful. Now, there's other ways you can study. Okay. Now, if you use this, if you try to use it on your phone, stuff's going to get messed up. So don't try to use it on a phone. Go home and see if you can kind of get a file that's unmodified when you download it onto another device. I have the keys out there. And in anatomy and physiology, the thing that drives instructors like me crazy is students try to study without knowing what they're looking for. You have your list, and you say, oh, where's oviduct? And you look at the key, number I don't know, 17. Look for 17, and you're obsessed with finding the number 17. And that can work, but I feel it's better to use the keys to confirm what you already know. We did the coloring, you have your book, any book, like this one. And you use the book, say, oh yeah, that, and you look at your notes, you look at the coloring you did, that's the oviduct. Then you use the models to say, okay, here's the oviduct on the model. Oh wait, there's a number on it. It's number 14. Look at the key, see if number 14 is the oviduct. And it just confirms what you know. I think personally, that's a better way to do it. Students over-access on numbers, and you just know the numbers, but you don't really know the anatomy. And that's partly, well, you got to decide how you want to learn. And you got to decide who you want to study with. And I expect students to treat each other with respect, because look at all the models that we have. There's not too many. But look at all the people that are in this room. So that's why when I give labs like this, it's pretty much an independent study time. You don't have to stress out and say, I got to get it all done today before 12:45. We're going to do the same thing tomorrow. You can say tomorrow. You can come to Open Lab on Wednesday. And any time between now and the lab practical, if there's time before 12:45, you can take any model and you can study. The lab practical is not until Thursday the 27th. That's next week. Okay, so you should start today. You have any questions for me? Some people ask me for coloring plates, and what I'll do is I'll just upload what I have on the Canvas. That way you can kind of print out your own copies if you want additional ones. Okay? So go ahead, go right into lab time. There's nothing to turn in today for points. Just take the time to study, and I'll upload histo photos right now so you can study for the quiz tomorrow at 8 for group A.